Assalamu alaikum and welcome to the show Mindful Matters on Radio Al Ansar at 90.4 FM in Durban and 105.6 FM in Pietermaritzburg. A show that promises to provide an hour of inspiration, information and motivation with me, your host, Nazia Iram Osman. Please feel free to participate in the show. You may WhatsApp your questions, queries, feedback or comments. The number is 060 904 1056. So, the topic for today is postnatal depression, formerly known or diagnosed as major depressive disorder, peripartum onset. The birth of a baby can trigger a jumble of powerful emotions, from excitement and joy to fear and anxiety. But it can also result in something you might not expect, and that's depression. A recent article explained that 48% of new mothers have postnatal depression, but most do not seek help. Most new moms experience postpartum baby blues, as we call it, after childbirth, which commonly includes mood swings, crying spells, anxiety, and difficulty sleeping. Baby blues typically begin within the first 2 to 3 days after delivery and may last up to 2 weeks. But some new moms experience a more severe, long-lasting form of depression known as postpartum depression. Rarely, it's an extreme disorder called postpartum psychosis, and this may also develop after childbirth. Postpartum depression isn't a character flaw or a weakness. It's simply a complication of giving birth. If you have postpartum depression, prompt treatment can help you manage these symptoms and help you bond with your baby. And to tell us more about this is a medical doctor who specializes in psychiatry, Dr. Javanika Moodley. Welcome, Javanika, to Mindful Matters.
Thank you very much, Nazia. I'm so happy to be on the show today.
I'm glad you came. We have to congratulate Javanika on the birth of her second child, a baby boy born in August. And if only you could see her, I don't know where she held or where she carried this baby. So welcome and congratulations.
Thanks, Nazia.
Okay. So, Javanika, maybe you can tell our listeners a little bit about yourself and your work experience or the work that you do.
I studied in Cape Town as a medical doctor, so I'm a GP, and I've also got my diploma in psychiatry. Mm-hmm. So that was something that I am very interested in, anything psychiatry, and so I ended up doing a diploma. I've also did a bit of, I've got a business administration certificate through Dublin when I was doing my work in the military.
No, I didn't know that.
Yeah, and I've qualified as a yoga kids instructor as well. So it seems a bit, all over the show. Yeah. But I think at the end of the day, I'm aiming and angling towards a wellness kind of image. So I generally don't actually think of wanting to treat people for illnesses and rather focus on their wellness and
so you're in the business of wellness, almost managing them on that.
Yes, because I feel sometimes we wait for people to get sick and then we scuttle around and try to fix them and do things. But if people could take more sort of ownership and autonomy and encourage them to look after themselves better.
So more on prevention than just coming with symptoms, curing the symptoms.
100%. So that's where I'm kind of going. I currently have a practice in Durban North, but I've moved now to a new building in Talkshow House, which is in Umhlanga. Right. So that will open in December. Yeah. So you and I know we both work from the Durban North Smile Center. Right. And so we're there on for sessions basically whenever patients in our Durban North component needs us. Yeah. I did quite a bit of work as well with some of the religious organizations and things with substance abuse. Mm-hmm. So when I went on maternity leave, I didn't have access to those patients. And so that's also another element of that I've been working with quite a bit. Yeah. And then the new part that I've sort of branched into a little bit is aesthetic medicine as well. So I'm doing a little bit more of the vitamin IV, glutathione drips, that sort of thing. Right. Medical microneedling, because you probably hear so many people doing it. But
microneedling, definitely.
But it's nice to, I think personally, if a doctor does it, where you know that it's in a sort of safe environment and it's a controlled environment and things like that. So ultimately, my new place will basically be a wellness center, focusing on the overall sort of physical, mental, social well-being of patients and things. And even like when it comes to prescribing, I don't really like prescribing medicine in a hurry. Okay. I really would rather say go for a walk or change your diet or do those kind of things, like prescribe those kind of things rather, And so in that way, people sort of literally take you're making them like sort of autonomous about their health.
Right.
And I think that's really important going forward.
Yeah, no, definitely.
So,
I agree with your focus. But if you listen to Javanika, she's so humble. But I think she's leaving out this huge part, because how Javanika and I first met was at R.K. Khan Hospital. I think I was an intern there, and I think you were acting HOD of the psych department.
Yes. Yeah.
And yet you don't mention that. And if anybody has been in R.K. Khan, they would know it was quite a difficult place to work at, especially in the psychiatry department, seeing the patients in the state that things were in. It was quite dire.
Yeah.
And yet you were there, and I remember the one thing is just you used to smile. You still have that same smile. And it was dark, right? It was quite a lot of pain there.
I stumbled upon I think across the board, I've been interested in psychiatry all along. When I was a student, I did my elective in the maximum security division in Falkenberg.
Wow,
I chose to go there. It was like I wanted to.
Yeah.
And a lot of people say, why? It's dangerous, and it's...
Because even Khan's, the cage was there, and it's almost like prison.
And people generally would say, you're a girl, like you should be a bit afraid and stuff. But generally... And like you said, the smiling thing. So people underestimate you, but the patients quickly learned that you can be strong when you need to be.
And you have to have your boundaries.
You have to have your boundaries because people would just take, But in general, I mean I was acting head of department for a while. Right. It was not because I'm a psychiatrist. Like I said, I have a diploma, but that puts me in a good position even now in my practice, because I'm able to. I've got that experience behind me, and there's if you have to phone and make a booking to see or to get access to a psychiatrist, it's difficult.
Yeah.
There's a long waiting list, and people. There's so many people that are afflicted with psychiatric illness and need help, and also it's expensive and things like that. So it's a good sort of in between thing where you're seeing somebody who can prescribe medication for you, who also understands the dynamic and where you're coming from and things. That said, I mean, I was in Cairns for 6 years, and I do remember meeting you.
Okay.
And we used to see the psychology students with us on Wednesdays, I think.
Yes, it was.
Yeah. And we learned a lot from there as well, because the thing is, at the end of the day, treating those patients, it shows us that at any point, all of us, any of us could be afflicted with a psychiatric illness, and none of us are above it. I literally think it's a great leveler. Like you'd be treating a doctor, you'd be treating
definitely
a teacher or whoever in the cage, as you call it, at the same time.
And sometimes it's hard to believe them, because I've met some doctors who had bipolar, and we met them while they were manic, and you think, I think you're lying. But they are really doctors.
Really are.
So it's so sad that it can be anyone.
And I think the humbling thing for me was people would walk in, and they'd look like you and me, like we're just walking in for something. And the moment they start speaking, you realize, like, oh my gosh, this person is dealing with so much and is able to kind of put it together and function in a world that isn't really
and I think that's the other thing. It's not like we just mentally stable and not, or mentally ill or not. It's a continuum.
There's a big continuum, yes.
And
that's the
some
thing.
days, and lots of people tell, some days we act a bit out or erratic, and some days we don't.
And that's a normal thing. I mean,
it's a normal thing.
So when it tips
when you
over
stay
into
in that forever, a long time,
issue.
that's when you get
So my psychiatry time was 6 years, and it was actually very, very. I mean, I would go back. I would say I would go back in a heartbeat, but I think I was pregnant. I was pregnant when I was being chased by somebody with a plate of feces, and I think then I was like, okay, maybe not, But that's
and you have to keep a straight face, and you cannot show reaction, because they react to it.
In fairness, though, this was a lady who had postpartum depression, just by the way. So
that brings us to our theme.
Brings us to the fact that it can spiral out of control so quickly.
So was it postpartum depression or postpartum psychosis?
This lady was a postpartum psychosis. So she was somebody who, you get postpartum illness, and then we call it a brief psychotic episode.
Right. So even with depression, you can have the psychosis. You can have a psychosis. And even without the depression, you can have the psychosis.
Yes. Yeah.
So maybe it's a good place to start that. What is the difference between a psychosis and a pure depression?
A depression. Okay, so the psychosis is generally it's when a person is out of touch with reality. So here the person is, they call it hallucinations or delusions. So they're hearing voices, or they believe things that are not true. So they might feel that somebody is trying to kill them, or the mafia is attacking them, or
so
people are recording
paranoia
them.
In the delusion.
There's a lot of paranoia in it. Often it's paranoia. I remember the first time I had a patient in Cairns, I was called to the gynae ward for this, and they said, no, the lady is saying that she just had a baby, and she's saying that that she's got a big. The referral letter said the patient has a big butt, and people are talking about her butt and they're laughing at her. And I remember reading it and thinking, what idiot wrote this? Like, obviously she might have a big butt. She just had a baby. You know what I mean?
And sometimes you want to believe them.
And so I'm thinking like that could be normal. And then when I went to speak to the lady, you can see then this lady is really out of touch with it. She doesn't think that child is her. She feels that they switched the baby. She knows it was this and it wasn't that, and very, very, very paranoid about the nurses. They're putting things in her drip. They're doing this to her. The other patients are all jealous of her. Her baby is dark or fair or whatever.
I remember meeting a former matron who gave birth to twins at Khan's, and I wanted to believe her because there was no depressive symptoms. But she said people are listening to her through the walls, and in the night they speak. And then I was like, oh man, you were making so much sense till you said that. So if they don't have depression,
100%, you can actually believe the person, and But I think what was so sad about that is. And then that comes to the part where you actually need to act quickly when you see these patients, is that, one of these, I saw this lady in the gynae ward, but she later progressed to being in the caged area, the sort of lockup area, simply because she was so out of touch with it. She was naked, she was, licking the floor and doing all kinds of strange things. And you think she's had a baby, it's this beautiful experience of childbirth, and it's so not what we expect,
exactly.
And how
it's
debilitating for this mom, to have this baby that's now doesn't have the benefit of this bonding and attachment that you're supposed to have with your newborn baby.
Right. And those first few days,
it's so important. And they've literally kept them apart because she's supervised. They almost treat you like an animal because you're seen as a danger to the baby, and I mean, rightfully so.
But at the same time, if you're out of touch of reality, you can't know how.
You can't take a chance.
Look, we're not here to shame. I don't want to frighten the listeners. Is it rare or is it?
It's rare.
It is rare.
It is rare. Yeah.
And
so don't be afraid. It's like
cases.
1%. I mean, it happens. But I mean, when you see it, you are a bit afraid. Like I would have told my mom, listen, if this happens when I have my baby, you need to do whatever.
I don't know if you've heard of this term, and I don't know if it's how you pronounce this term. In the Indian culture, they'd say, don't do this or don't do that, or the jano will catch you. I don't know.
I've heard that word. Yeah.
And
don't wash
that
dishes.
Psychosis? Wasn't that what they were talking about?
I suppose because they're talking about they would say you get sick and you'd.
It wasn't so much.
Not so much. No, I don't think so.
I was wondering, were the old people cautious about something like that?
Yeah, I think a lot of it they'd say don't go out in the wind and don't go
out after a certain time.
Out of a certain time and things. A lot of it after having had a baby now, I think a lot of it is just common sense.
Yeah, a lot of it is logic.
It's like logic and common sense. Like, don't go out after 6, kind of thing. I know I used to get visitors and that come like late at night. I'm like, when you think about it, like.
But what about the support? I know back in the day, if you had a baby beforehand, you'd go like a month or two to your mum's place, especially if it's the first child. Thereafter, there wouldn't be a rush to go home. You'd be supported by the family.
And even besides that, you had the extended family. So that was another thing where we actually found. I know when I had my baby now, the gynae said to me, if you get help, you must take it. Because your parents are there and stuff, you must actually ask them to help you and sleep and whatever. Because in his words, Indian people had a less postpartum depression and things because of the extended family.
Because
we had that support structure
that was taken
and things.
For granted.
And now we don't have that anymore. We actually, if you think about it, you go home and you, in your own home environment with your husband and yourself and whoever else, if you drop the ball, there's nobody else to help you
to pick it up
and carry on with it, and that
now I don't want to offend any gender here, but female to female, the understanding and the requirements that you have of a mother and how to take care of a baby, it comes more naturally to another female. So an older sister, mother, granny, you wouldn't have to ask for
and
something.
they probably have been through it before as well.
They probably would have been through it before.
So it's
they would,
And it's just, and then the other thing as well is, I remember my mom said, come over, and I mean it's a natural thing to do that. And at first I was like, no, I have my house and I know where my stuff is and whatever. And then when it came to the second baby, I was a bit more open about.
Because you realized you need that.
Because I said, oh, okay, it makes sense because if you in somebody else's house, you are a visitor there. So there's no pressure. automatically you want to go and do things.
Yeah.
And there's this thing that if someone is there, you have to go and give them tea or biscuits, whatever, and you're still
you're taken
dealing with this
care
new
of.
baby. And
because what people forget is baby is fragile, yes, and needs to be taken care of, but so are you, because with the birth of a new baby came that new role
huge
of
emotions
a mother, and the hormonal imbalances.
Well, that comes to what we were talking about
About,
initially,
yeah,
right? Because we
last
spoke about postpartum psychosis and then the difference between postpartum depression. And I think the other thing to talk about is the baby blues.
Right.
So baby blues is, I think, almost 80% of people have experience baby blues.
Yeah.
And that's basically that sort of tearfulness and feeling overwhelmed, and I can't do this, and not bonding so much with the baby. And
usually by the third day, there is some sort of, I don't know whether the hormones are going through some sort of, I don't know
change,
what, change where there is that extra.
There is that. I mean, you have it where you almost, because the thing is, if you think about it, you're living your little life, and then suddenly there's this person that's crying, and you're supposed to know what to do.
And 24 hours, they have to be on.
Yeah. And the other thing is, I would think as a doctor, like you'd know more or something. You know, you're almost
expected to
know. I know. And I've taught people in Khans and stuff. We teach people how to breastfeed and how to hold the baby and how to do this and how to that. When it comes down to your own, you actually know nothing. You don't know anything.
Yeah. And every child is different. The child comes with their own temperament.
Same thing. It's a new baby, new times, different temperament, like you said. Yeah. So the baby blues, I mean, it's self-limiting. It generally, it's about 80% of women go through it, and it disappears by 2 weeks or so.
So it's more like moments of sadness, moments of anger. It's not
overwhelmed,
a deep, dark feeling of blues that I'm stuck there.
Yeah,
right.
On the other side, the postpartum depression, that's actually a full-on depression. You know, so where there's the criteria for depression is feelings of a depressed mood. So it's the 5 of 9 symptoms, where it's depressed mood or irritability,
anger, impatience, irritability.
Yeah. And then the appetite changes, the feeling that you can't, what's this, anhedonia, where you feel like you
just
no joy,
have
no joy in life. All the
Yeah.
things that you used to enjoy, you just feel no list to do anything that you used to do before. And that carries on for at least a period of 2 weeks.
And I think people need to understand that it's not just normal sadness.
Yeah.
It can be sadness, anger, irritability, impatience.
Yes.
So people might get annoyed with you, but they don't understand that it is that negative mood and that not being interested. Some people say, "What's wrong with you? Come, wake up. Why are you demotivated?"
And snap out of it and things. And if you could snap out of it, I think if you hear that and you're depressed, I think you're probably going to smack somebody themselves.
Because you're feeling bad, then you're feeling guilty that you
feel this way
you
already,
And especially with having a baby, because people say, "But you wanted this child, or you prayed for this child."
Yeah, and now you're here and you're acting like this, And I think the main thing is that it's not a choice that they're making. It's if you could not be depressed, I'm sure you would not be depressed.
I mean, if there was, I mean, okay, I do understand that sometimes you have to push yourself. Or the people that love you will say, "Do this," and you behave in
and you can't sit there
even if you're not in the mood.
Doing nothing,
But at that point, when you're in deep dark depression, you can't just
and you probably are not open to hearing anything at that point. You're so overwhelmed by these feelings you have and stuff, and often these mums are not waking up. If they get to a point where they're not bonding with the baby. Sometimes they get suicidal. Or they have thoughts of harming the baby themselves. I mean,
and I think that's a big one, the thoughts of harming the baby, because that's part of the depression. Thoughts of harming yourself, thoughts of harming the baby. I can't cope. What is this? Almost as if you're looking at that child and you're thinking,
if it weren't
what
for
are
you,
where have you come from?
Yeah.
And that is like inability to bond. But the thought of harming your baby, people will look at what kind of monster are you. Yeah. So no one will be brave enough to say, "I'm having these
feelings." And so people, and that's why a lot of patients with postpartum depression, I mean, it's as common as, well, it's 11%. It varies, 11% in some places and like up to 40% in others, the incidence of it. But the fact of the matter is that we all know somebody who's had it, and then the sad part is we all know somebody who's had it, and we all should have known somebody who had it, but we didn't pick it up. Yeah. Because often it's these quiet mums that sit and just struggle along because they sort of feel the fear of being victimized, or the fear of, like you said, why aren't you happy?
The guilt
look
of
at this baby. How can you look at this child and not be happy? And yet there's this disconnection with this child that you can't help.
Right.
You know?
And I think that lack of understanding, because I think the ones that are going through depression, they don't know what's going on. Why am I feeling this way? What am I even feeling? To even put a label to it, I'm feeling sad, I'm feeling depressed, I'm feeling angry. They don't know, because when you're sucked into it and you're feeling all of that you're feeling, it's so hard to rise above and say, this is not normal.
This is it, and I need to get help at things. And this comes to why I was also very interested in this, even in my practice. I joined like these, when I became a mum at that point, I joined Mamahood Natal. It's this Facebook group, right? And basically, it's like, it was a nice forum for like meeting, like hearing other mums' issues and problems and things like that. And what came up all the time was this postpartum depression story where people were afflicted with it and reaching out to other moms trying to see how they could get help. And the biggest issue was that
okay, so I guess thanks you. Then I have to pause a little bit here because we're going to stop for a quick ad break. But we were talking about such an interesting topic about postnatal depression. We discussed the difference between baby blues and, not to frighten anyone, but postpartum psychosis as well. And we'll catch up with Dr. Javanika Moodley after this short ad break. Welcome back to Mindful Matters, where we're speaking to Dr. Javanika Moodley. So Javanika, sorry man, we interrupted you there. So let's pick up where we left off. You were talking about a support group on Facebook. Maybe you can tell us a little bit more about that.
So I was telling you that I had access to this group, and I think it helped me quite a bit to see common problems that other mums had, and what, like I said, came up often was the postpartum depression component. And then just these mums reaching out and saying like, this is the problem I had, and how they were feeling and things. And what struck me was that the number of mums that had this and had to just live with it, because there's no way of you're in this position where you can't say, I'm going to go get help. It's easy for us to we can cover treatment just now, but it's okay to say, go for counseling and go for this and go for that. But how do you practically do that? Because here you have a newborn baby. It almost feels selfish to
have to go through that process.
To the process of packing this child up and then getting in a car and then going to get treatment and stuff. And that's where, at that point, I was starting to think about a mobile, like a unit where you actually go out to the postpartum mums and things and assist them in that way, where you...
That would be great, because I think UK had something like that, where they come and support the mums at home.
The mum itself, because it's so... it really is hard to get out, and it is hard to prioritize that help.
And then even tell someone, I'm going somewhere, can you take care of baby? Where are you going? Why are you going? What's going on?
And then when you start talking about it, and then there's the stigma around it. When it comes to anything mental...
Because I know even when some of my patients are depressed, I say, the world doesn't need to know you're on antidepressants, because the stigma around it and the stories around
huge.
it.
If people feel the need to I always say to them, if you're on hypertension meds or diabetic meds, do you have a sign on your head that says you're on it? No, but why do you feel this need to disclose that you're depressed and that you're on antidepressants? Why?
But only those that are relevant, who need to know.
Yeah, no, for sure.
To know, talking about medication, what is the best treatment for postnatal depression? Is it only meds, or is that the first line? How does it usually work?
So with postnatal depression, I think the important thing is to actually get help quickly, okay, in whatever form it is. Antidepressants are actually sort of not the last line, but they're not your first line. Yeah. Right. You ultimately want to encourage this person to have counseling. Right. So you do talk therapy, basically.
So you refer to me.
Yes, I'm sending it to you first. Right? So it's basically you basically trying to get that person to sort of unpack what they're feeling, speak about it, get the counseling, get sort of the understanding of where they're at, and that it's normal, and validation, and basically just get someone to listen and normalize
I laughed and I said, send to me, but I think even before the psychologist, other mums that have been through this, that would be the best if you could get to them, because that kind of conversation could take away a lot of the stigma and
around this.
Coming.
And then the other thing is in psychotherapy as well. So you're going to do psychoeducation, which is what you do, and then psychotherapy. But you also do like cognitive behavior therapy, because you're changing the thought processes that I'm not good enough, or I can't do this, or I'm a bad mum and stuff, and just basically give them the tools to rearrange that thought structure in their head and give them better tools to deal with it going forward, Right. And then there's also a huge amount of people taking part in like relaxation techniques and things. So that's something that you need to, if it's yoga or if it doesn't have to be, I've found an app it's called the Calm app.
Yeah.
On
Has
one of these
beautiful
groups, and
sounds to it, yeah.
and so basically you can just do something like this in your home. So it's making it.
I've actually inculcated that in my therapy. What I do in between as homework, I give them the app to follow.
That's good.
So that they can practice it.
And the thing with these things
themselves.
is practice makes it perfect. Where you
and
get to a point where
the brain
it becomes
rewires. So it makes it easier when they do come to us.
And that's why I did the kids yoga thing, because I honestly feel we just bombarded with like stimulation and stuff like that these days, and if people can get to a point where they can actually be calm and sort themselves out by themselves, it's a good place to be.
So like finding time to, I wouldn't say formally meditate, but to just be quiet, or even some subtle forms of stretching, things like that would really help.
It comes down to even you're asking about advice, that people would give. And that is what I would tell people to do, is to make sure that this mum takes care of themselves, that they actually take that time out to do these things you said. If it's a minute to read a book or whatever it is,
find time for
find
yourself,
that time,
so
quality
self-care.
time with yourself, with the actual self, and things like eating and exercising and things like that they should actually
be doing
it. That's more important than anything else. And then in terms of people, we were going to talk about people finding out about it and wanting to help you, and how they could help you, encouraging them to talk about their feelings. When you see someone, actually listen to them. When you visit someone, listen to what they're saying. Don't try to and
don't try to give advice.
To give advice,
how to feel.
And help around the house. Be practical. Go and take over a chore. Cook a meal and take it with you. Those are things that someone might not want to ask you for, but would probably need.
Right.
Yeah. So.
Right. So I guess I hear what you're saying. So be practical, be open to listening to them, and that's some of the best things you can do, is just be there for someone that's going through depression, and if necessary, maybe guide them. If
you have to babysit for them, if you have to let them have a date night with their husband, if it comes down to that or something, those are little things that little bit of time actually is so beneficial to a mum. Getting to a point where they feel okay with things.
I'm so sorry. We're having one of those days. We're going to have to just pause again. We're going to cross over to Samira Kadir, who's at the Spring Fair, and then we'll get back to talking a little bit about depression. So, I don't know if Sister Samira is online.
Thank you. It sounds like a good fair to go to.
It sounds like a good fair. And I want you to laugh when you said the first thing we saw was colostrum, and it's from breast milk, right?
Yeah.
And I think let's tie it down to our question then. Meds, are they safe when you're breastfeeding?
You like, as I was saying, you use the other therapies first, and then you come down to antidepressants. If you need antidepressants, then you need antidepressants. I think everything comes down to a risk-benefit kind of ratio. So if you have a mum who really needs the assistance of medication, then she needs it. I mean, in the grand scheme of things.
Okay, just say she is depressed and she's a moderate depression. What would make us say, okay, now she needs meds? What would be the deciding factor?
I think that we would, if we could see that the therapy option itself alone was not working. So we've given her the option of counseling. We've given her proper psychoeducation, and we've had a couple of sessions, and we can see she's not actually moving along, kind of thing.
She's kind of stuck in that.
Kind of stuck in it, and you have to, it's actually, I feel it's actually criminal then to leave someone to. And sort of treated at that point, especially because
risk as well. Do you think that would, if she's at risk of self, or she's having ideation?
Well, if ideation, that I think that would put her right up there. And then the second thing with that is, if there was any sort of, you'd assess the suicide risk, and then if necessary, you might have to admit a patient like this, and that comes even with the postpartum psychosis. I mean, in this instance, you actually remove the mum from the situation, and you admit her, and you give her that ability to get better, and then let her reintegrate with the child and things afterwards.
And look, I want to push this question. I know we're short for time, but tell me about postnatal depression in dads. Is that a possibility? Can dads get postnatal depression?
Yes, I actually didn't. It didn't even occur to me. At one point I remember thinking whether like my husband could actually get postnatal depression. I mean, I was having it because
where they feel your pregnancy symptoms.
Where they have like phantom things, and they put on weight and do all kinds of things. But and backache, yes, But besides that, I actually found out that it's about 1 in 10 men that have that experience post. Yes, it's huge. Wow. So it's something that we don't talk about, and I think with ladies, as much as we don't talk about postpartum depression, we speak about it about it a bit more
than the men.
Yeah, the men, it seemed as like something that they shouldn't ever experience. So it's really not
addressed. I can imagine depression is bad enough, and postnatal depression, my God.
When you didn't even give birth. You know what I mean? Yeah, give us one thing. Let us have this postpartum depression.
Want that one.
No. But in general, though, I think they present differently. They have more of the irritability and anxiety, and I think also back to that old thing we were speaking about of where there were extended families before. We don't have that now.
And there wasn't so much expected of the men.
There's a lot more expectation on a dad to do things now. In the old days, I mean, your granny was there and your auntie was there and your whoever was there in the house, and so we all kind of looked after the baby together.
In the birthing room, it wasn't common back in the day for dads to be in.
For a dad to be never.
But
I mean,
now
it's a normal thing. If they're not there, you're gonna beat them.
Probably would beat them. Yeah.
No, but it is something that's very common, and it's not spoken about. And I think it's something we need to be cognizant of when we're seeing mums and things. Actually take a minute to stop. And it's not just that. Even in anything psychiatry, I always think the person who's living with the person often gets overlooked. They end up with burnout.
We're not saying it's contagious, but I mean, to live with a person who has
it's really difficult. I mean, they question everything. You treading on eggshells. And remember, the birth of a baby in any relationship is a challenge already.
Exactly. The moment there's change.
Yeah. So feeling displaced out of your normal dynamic that you were in, that you've been in for however many years, and now suddenly
I think what we forget is both partners can be depressed at one time.
100%.
It can happen.
Actually, it's a bigger risk of it. That's one of the big risk factors for postpartum depression is when somebody is has a partner who's
what are the predisposing factors? What makes one partner more, or not partner, what makes one person more at risk of getting depression?
Of getting it. It could happen to anybody. I don't think at the end of the day, each pregnancy and each thing is different, and you at a different phase in your life. But some of the things that do commonly come up is if there was a previous depression before.
Because if you have been depressed before, you're probably predisposed to it now.
Or previous anxiety or any sort of mental illness. If there's a family history of that, there's a 50% rate of you having a second postpartum pregnancy. Like if you had postpartum depression in your first pregnancy, that you would probably have it. So there now you have to be careful, and you I mean, those things help you to be prepared, basically, The other things is if the pregnancy itself, so you go down to the pregnancy, was it a planned pregnancy, was it a unplanned pregnancy, was it a wanted pregnancy, wasn't it wanted? What was the experience of the pregnancy, what support did you have in the pregnancy? So mums who haven't had that support structure, so
the environment makes a difference.
Huge difference,
well.
big
so even if
difference.
You've never had it, and there's not any genetic inclination, if the environment is not supportive,
it can push you. It's probably one of the biggest factors is the lack of support, whether it's from your partner, whether it's from people around you, and then the financial is another thing. That's also another thing where you feel that financially unstable or insecure. It seems to have an impact. A lot of the studies that were done were actually focused more on sort of lower socioeconomic status patients, but that is also a risk factor, is not having
so even the economic facters, like if you're struggling to make ends meet, how will I cope with another baby?
They're more likely to actually be afflicted by
I know when you work in government, you see this. You're dealing with someone with depression, but they're hungry.
Yes.
So a basic need like food
is not met.
Is not,
so where are they going to even think about treating their depression? And this is the thing: if you something untreated, because that's my mainstay, is that whatever you see, even if you see somebody and you know that they are depressed or whatever, the main thing is to get them treated quickly.
Right.
With all psychiatric things, in psychosis it's called that duration of untreated psychosis. But I think it's across the board. If you just leave something long enough, it complicates and progresses and worsens. And so with any person that you see that's you suspect it or you're worried about it, get them to
come out for help. I think the other thing, they try to cope themselves. Maybe they'll start self-medicating or doing other stuff to compensate for these feelings, which could be harmful.
Yeah, and I think also there's a time and a place for a medical person to jump in. Often when a baby is born, there's a million experts out there telling you what to do. And I think as a mum, you don't know who to. This auntie is telling you to do it this way, and this auntie, and each one wants you to listen to them, and you kind of, you just don't know where to turn,
and you doubt yourself,
and you doubt yourself, and so you just
decisions.
Put yourself in a tiz, and actually you just calm and you can do it. So
Yeah. But thank you so much for coming. Time has gone by so quickly.
That was quick.
Yeah,
There I
very,
was
very
worried.
fast. Yeah, you were worried. But well, thank you for making the time. And I'm hoping we catch you on another day, to talk about some very interesting topics. I'm not going to let the cat out of the bag. And, just to round up, for the thought of the day, I would like to use the words of a mum that has been through it. And she writes, without postpartum depression, I would not know to ask new mums how they really are after doing childbirth. To not just assume that motherhood is all rainbows and unicorns. I would be cognizant of the fact that so often, especially in those early days and months of sleep deprivation and hormonal fluctuations that mark the arrival of a newborn, a mum is at her lowest and frailest, both mentally and physically speaking. Without postpartum depression, I would not be the mum I am today. I would not have discovered the strength, resilience, and inner warrior I had, hiding within myself, ready to battle. So I know it's hard to admit, but people, if you do need help, consider reaching out and let's help you with the treatment plan. And, then you can enjoy baby as you deserve to. And Jazakallah for listening in today. And I look forward to catching up with the next week when we will chat to the lovely ladies of UCEC, again, speaking of gender-based violence in light of the recent spate of violence against women and children. So we're looking forward to speaking about that. And now it's time to bid you farewell. Remember, be kind, be mindful, and enjoy the rest of your week. From me, your host, Nazia.